So if the ACO was truly the center of the gravity, it's designed to be inflationary, not deflationary. And yet the applications of AI thus far are happening outside of the ACO. So maybe Sam, help me navigate wearing your Valtros hat. Is the intelligence layer that has the full promise of AI, acknowledging it's sitting on fragmented data in every example, where do you see the greatest intelligence layer impact thus far? Is it in fact on the inflationary sides? And if so, what's the mechanism to bring it into the deflationary side, the world of Emily?
You may be right, and there is enough written about it. I think there are other examples where people have pointed out how it's being used, but those are early uses. I feel like the early uses really fall into two categories. You take complex operations and you can start to automate them with these new tools in ways that you could not do it with traditional AI. So the world woke up to AI in some ways at the end of 2022.
Yes.
But the first time I heard that term was from a friend who did a PhD in computer science in 1985. The problem was those tools were not really easy to use. They required a level of competence which only a few people had. But the beauty is that I think in year 2000, total amount of investment that went into AI was estimated to be $1 billion. In 2026, I looked up and I was blown away. It exceeds $1 trillion of total investment that's happening, including all the data centers and everything going into AI development. The beauty of that investment in the last 3 years is that these tools are being developed to the standard of they can be used by consumers. And that just makes them really, really easy to adapt. So my feeling, coming back to the core question you're asking, is in the short term, it may be that you're just taking complex operations and automating them. You may be taking some revenue generation side. You might be using them in obvious places. But the real problems to be solved are, what is a better care pathway? How do you actually coordinate care? And yes, there is fraud and misuse in our industry, which is estimated to be 1/3 of the total cost. But imagine when you have both the more complete data set and you have the better tools put on it, it won't be that 3 years later someone's writing a paper about how fraud's been going on. You can actually pick up the patterns when they start to happen and tamp down. So my feeling is that in the next, even as short as 2 to 3 years, a whole bunch of use cases that ultimately help the individual, both in the quality of care, but the industry and affordability will really start to develop.